professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty position at Ross University School of Medicine. And in this video, I'm going to be going over global health from a global health perspective. This is a program of the Task Force for Global Health, and I'm going to tell you in a minute why I'm lecturing on this today. Actually, I'll tell you now. Today is World Field Epidemiology Day, and so this is empowering field epidemiologists who have helped public health systems around the world. Of course, I have conducted field epidemiological studies as well, and it's quite different, and I have coordinated quite a few globally. From Nigeria to Nepal to Guyana to many different countries in the world who have coordinated research projects and theses. So looking at TEFANET, Training Programs in Epidemiology and Public Health Interventions Network. So there's training programs worldwide, and you can kind of look through these to not only look for what is available, but look for programs that may apply to your local area to implement. So there's 91 active field epidemiology training programs in 165 countries globally. So the United States Epidemic Intelligence Service is one of them, which is interesting. Canada Field Epidemiology Program, and actually the Epidemic Intelligence Service program. My father has been has had mentees in the EIS for many years. So that's a very good training program. And then Mexico has one. And Brazil, and so you can look worldwide and see what types of field epidemiology. Hong Kong Field Epidemiology Training Program, I don't know too much about. This is why I clicked on this, but here it was founded in 2004, members since 2006, 12 graduates, which is not too bad, but not very active. Whereas if you do look at the EIS training program, then you'll see that there's been more that's been done. If it's a clickable link, sometimes it's not. Well, anyway, so this is exploring another field epidemiology program where in the training program people go into community settings and ask about various topic areas, including bloodborne infections, zoonotic diseases, sexually transmitted infections, opioid crisis, extreme weather patterns, and many other areas. So you can go through this website, but this is the main website for TEFANET's World Field Epidemiology Day. Goes into the John Snow story and field epidemiology and disease detectives, all of those things, and how work advances evidence-based knowledge and strengthens public health policies and interventions. So many field epidemiologists have a multidisciplinary expertise that allows them to respond to a wide variety of health issues. So for this, and I'm not going to make this video too long. I wanted to provide you with some of the important details. And over here, talking about the global field epidemiology roadmap. So what's the background on this? Is that in 1980, the CDC began supporting the development of field epidemiology training programs in countries throughout the world. To safeguard and promote the health of its citizens, every country must have effective field epidemiology capacity. So this initiative has grown in importance since then, as many countries and regions and regions with inadequate public health capacities face public health threats. So increasing scope and complexity these problems are becoming increasingly complex, and so community health, community level, community setting health is really important to be focusing on. So the field epidemiology training program is a great success. 86 programs in 160 countries. But the number and variety of and the number and variety of programs have increased, and so that brings problems as well. So here are the recommendations, and I think this is what everybody was waiting for. Just trying to understand what these are. Number one, broadly representative strategic leadership group should be established to provide a driving force for progress for the field epidemiology training program enterprise. And this group would monitor the need for change and enhancement of the field epidemiology training program enterprise, develop and promulgate action-oriented guidance, recommendations and standards, and commission specific work to develop needed tools, systems, and policies. And this sounds like many policy level strategic interventions that are implemented. So the strategic leadership group should continually monitor and ensure needed improvements and changes in the training program, especially as regards the need to expand and modernize training program core competencies and curricula. The SLG should promote the development of applied epidemiology workforce targets at each level of expertise, so frontline, intermediate, and advanced, to support the development of a workforce capable of meeting country-specific public health and global health security needs. For instance, the community level setting that was applicable more so in a certain region in Nigeria is no longer necessarily applicable to another region of Nigeria. Or understanding how different traditional cultural belief systems play an important role in the treatment process is another example of how some of the field epidemiology training programs need to consider local understanding. So what are we doing here? Number 4 looks at looking at the strategic leadership group, which assures development of a cadre of specially trained FETP fellows and alumni available for rapid response to health emergencies, including but not limited to major outbreaks of infectious disease. So the strategic leadership group should work with country partners to accelerate the rate at which FETP's training programs become fully institutionalized. And this is all three: programmatically, technically, and financially into country health systems. The strategic leadership group should continue, strengthen, and expand efforts to assure and improve the quality of training programs, as well as supporting network-level elements of the FETP enterprise. The leadership group should promote and work to assure sustainable funding for all elements of the global training program. And then finally, the strategic leadership group should foster enhanced alignment and integration of the enterprise with key global health programs and priorities, including, for example, global health security, One Health, and universal health coverage. So together, all of these 8 critical enterprise functions and recommendations for action, together with that and the vision statement, conceptual framing, enterprise functional elements, these can comprise the roadmap to the future for the global FETP enterprise. So the roadmap is intended to guide and coordinate the work of many partners and stakeholders engaged in the effort. Much work is yet to be done, but field epidemiology training programs, even if they're not necessarily identified as such, are being built in many places, and I think need to continue to be created. And a lot of times it's not very extensive work that's needed. It's just getting the right stakeholders together in one place and trying to understand how to implement. So this goes into this is another paper, sort of similar to a white paper, but it's roadmaps are important too. And I talked about white papers, but here the recommendations are written out and then explained in a more detailed manner. So if you want more information, it's only 16 pages. I recommend that you go through this and see that it's aligned with the mission and the support, and how the strategic leadership group should be comprised of. And development of applied epidemiology should include health system strengthening, universal health coverage, global health security, the One Health approach paradigm, and that's the interface between human, animal, and environment, and the encroachment of habitats, and how all of these are impacting and changing the dynamics between human and animal. And then data analytics, data science, going into how some of the traditional paradigms in statistics and epidemiology are being enhanced by the application of artificial intelligence. And then finally, a humanitarian response and expertise in learning systems and knowledge management. So, recommendation 2, recommendation 3, these 3 goes into the development of a workforce classification for epidemiologists and a career path for epidemiologists. It's recommended that health workforce data for all occupations should be channeled through the National WHO Health Workforce Accounts mechanism and portal. In consultation with CDC, the Health Workforce Development has agreed to include a specific epidemiologist occupation at the 3 levels in the National Health Workforce Accounts platform. So this will not only ensure harmonization and standardization according to the International Labor Organization International Standard Classification of Occupation, but also enhance coordination of data collection. So this is all the different task force for global health initiatives. This is known as the Bellagio report supplement, and you can revisit this in greater detail, and then look again at the recommendations for the path moving forward. So these are the most important and pertinent elements of field epidemiology. Thank you for listening.